So ERISA, which is going to turn 50 in a couple of weeks, um, basically provided a framework to allow employers to self-insure their health plans. And what that means for large employers is that they become their own insurance company, right? They may contract with an insurance company to administer the plan, but it's the employer that's on the hook for any claims. The insurance company is not at risk; the employer is. And we've seen an increase in self-insurance since ERISA passed. Lately, the numbers have been ebbing and flowing. You tend to see that with surveys. It looked like for a couple of years, large employers were pulling back from self-insurance, but again, we weren't seeing this gigantic drop. It was a percentage point here and there every year or so, uh, which made me curious. But the definition of a large employer in the survey was 1,000 or more, and my guess it was the smaller end of the large employers that might have been changing their plan. Uh, for some, a couple of years ago, private health insurance exchanges were all the rage. And one of the exchanges that was very popular at the time required employers to go from self-insured to fully insured. That may have had something to do with it. It may be a statistical anomaly. It doesn't look like, again, we're not looking at a large drop in the percentage of large employers that are self-insuring. I think the more interesting thing is what's happening in the small and mid-sized market, where you have seen an increase since the Affordable Care Act passed, and that was expected. The one thing the data we have doesn't capture is the dynamics around these numbers, right? So to what degree are small employers going to a self-insured plan and then dropping it like a year or two later because they had bad experience? Even if they had stop loss coverage, ultimately the bad experience is going to show up in their stop loss premiums. So we're only seeing like the net number. The net number's been going up, but the sort of the noise behind that number is not something we've been able to capture, which is true of the large group market as well. There's some ways you could generalize when it comes to state mandates. Most large employers that are self-insured cover the state mandates, right? And there may be exceptions like IVF, but large employers are pretty generous with the scope of the benefits covered by their plan. I think the way in which employees benefit from ERISA and self-insurance is that employers that are self-insured, the benefit to the employer is that they're offering the same benefits to everybody, regardless of where they're located in the U.S. Right? It makes it much easier than offering 50 different health plans if you're in 50 states. And employees benefit from that because if they relocate with the same employer, they don't have to change anything with their benefits. Right? So they don't have to think about a new plan. They don't have to think about a different network. The drug formulary stays the same, so they don't have to change prescription drugs potentially. I think that's a huge benefit to employees. It's just that predictability of what their benefits are going to look like if they relocate.